Myeloma is a cancer of the plasma cells which affects the bone marrow. Although it's very treatable, it almost always comes back after treatment. This is called relapsed myeloma. Sometimes a treatment doesn't work or stops working. We call this refractory myeloma. This video helps to explain how relapsed and refractory myeloma might affect you. But first, meet Peter. He lives with his wife, daughter and dog, and works in the city. At weekends, Peter loves to support his local football team. But Peter also has myeloma. When he was first diagnosed a few years ago, Peter was very unwell. For a while, he was unable to go to work or do much. But the treatment he had was successful and put him into remission. Peter went back to work and was able to enjoy a normal life again. Every few months he goes to hospital for checkups. But Peter knows that one day the myeloma will come back. He always feels anxious about getting his results in case this time they show he is relapsing. One day, Peter's results showed that there were indeed signs that his myeloma might be coming back, even though he felt well. His doctor suggested waiting for the next results before deciding what to do. Peter's next results showed that he had indeed relapsed. Looking back, he realized he'd been feeling tired lately and his back had started to hurt. This was a blow for Peter and for his family. His friends and colleagues were worried for him too. Peter started his next treatment. This time he had to go to hospital every week to have his injections. At first, Peter responded well to the treatment, but lately his results show that his myeloma isn't being controlled very well. His doctor tells him he has become refractory to this treatment. It's also made him feel quite poorly. Naturally, Peter is very disappointed. He discusses what to do next with his doctor. He also searches for information and talks to other myeloma patients to hear their views and experiences. Peter wants to make sure his next treatment is the best possible one for him, and that it won't stop him doing what's important to him. He also decides to get a second opinion, because he wants to know all the possible options available to him. He finds out that there are several things he could consider. Peter has started his latest treatment, and for the last 12 months has been doing well. He's back at work and doing the things he loves most.